People with HIV has a higher risk of developing certain cancer. And today we are going to look at some of the reasons why people with the HIV or people who are HIV positive has higher risk of developing certain cancers. And we are going to look some of those cancers that a person with HIV will present with. So the reason why people with HIV has a higher risk of developing certain cancer is because virus severely damage their immune system and therefore making their own body difficult to fight off certain infection. So and those certain infection include the viruses that can lead to cancer, such as human papilloma virus, ep6 virus, especially a compressed immunity system allows those certain cancer to develop. And also we have some cancers which thrive well in people who have low immunity. Remember, HIV destroy immune system and your body is incapable of fighting off a certain cancer. So if you're watching this video and you have not subscribed, kindly subscribe because you are going to miss a lot. Comment, share, like the video. Don't forget to turn your notification bell so that every time I post a video, you'll be the first person to be notified. So the reason why people with low immunity who are HIV positive can get a cancer or they have high risk of getting cancer is because number one, immune system or their immune are suppressed. So HIV directly attack the immune system, leaving people with HIV less unable to detect and destroy cancer cells in their body. So that is the one of the reason why people with HIV will develop certain cancer, because their immunity is suppressed or is destroyed. The next point is that people with HIV has high risk of developing cancer because of a viral co-infection. People with HIV are more susceptible to other virus like cancer, like those virus like HPV, yeah, and Kaposi sarcoma associated with the herpes virus. Because of the same thing, immunity is low, and therefore these virus are able to thrive in their body. Also, another thing that you have to know, because of inflammation, is HIV infection can lead to chronic inflammation, which can also contribute to development of cancer. So you know that cancer is a tumor or abnormal cell developing or replicating, forming a tumor. So these cells can cause inflammation, and when there is inflammation, your body is at high risk of developing some of the cancer. Also, lifestyle factors. You find that someone is HIV positive and is drinking alcohol. You know, if you're drinking alcohol, your immune system is very poor. You are taking alcohol and also you are smoking. Those behavior can increase cancer. Yeah, those behavior can increase cancer compared to someone who doesn't take alcohol and is HIV positive. So what are those common cancer associated with HIV? Number one, Kaposi sarcoma. Kaposi sarcoma is a skin cancer, particularly prevalent in people with HIV, often caused by KSH something. They are caused by certain virus. Also, another cancer which is common is about it is non-Hodgkin lymphoma, a type of lymphoma linked to ep6 virus. It is also a cancer that can thrive better in people with low immunity, especially people with HIV. Also, cervical cancer, you find that people who have HIV or who are HIV positive, the hospital usually has that program of screening them maybe after 6 months or maybe after every 1 year, because they they are at high risk of developing cervical cancer due to increased HPV infection. Also, anal cancer, another commonly associated with HPV infection, is also common in people with HIV people. So, things that you have to consider when you are dealing with people with HIV or people with HIV positive or people with people who are HIV positive should consider is taking their heart or taking their drug as prescribed so that they reduce the viral load to zero or undetectable so that the immune system can be able to fight off infection, and also getting screened as what as per hospital policy or as per guideline policy. Some cancers can be screened after 6 months, some of them after every year. So they should get screened so that they don't if there is, it can be detected earlier, and then they start treatment earlier. Yeah. So that is what I wanted to talk about. That is what I wanted to say. Guys, today I'm stammering. That is what I wanted to say. So bye. Let's meet in the next video.